Hello friends, today I am going to take nutrition in pregnancy. So pregnancy, you all knows that it is a state of period which is beginning from the conception to the birth of the baby. So it will take 280 days or 40 weeks of time. So this time is known as gestational period. So it is the first day of the last menstrual cycle until the delivery. So this time is known as gestational age. So we can divide the pregnancy into 3 trimesters. So it is like first 3 months is first trimester. So here what is happening, that it is the period of organ differentiation, and the second trimester or the 4th to 6th months is the completion of the various organs or systems in the fetus, and the 3rd trimester, so here it is the period of final growth period of the fetus. So there are various changes is happening in the mother during the each trimesters. So what is the aim of nutrition? So aim of the nutrition to produce healthy normal weight infants by minimizing the health risk of the mother, and second thing is to appropriate weight gain. For example, now like normal weight ladies will be there, underweight mothers will be there, overweight people will be there. So we have to balance the weight gain during the pregnancy. So we have to give appropriate guidelines to increase the weight during the pregnancy. And again, like depends upon the additional nutrient needs. So we have to recognize it, and we have to give the additional nutrients for the pregnant woman, and we have to see the for example, we need some of the nutrient stores during the pregnancy. So we have to see that it should not get depleted during the pregnancy time. So the maternal stores should be used during the lactation time. So we have to see that during the pregnancy time it should not get depleted. So now coming to the physiological changes which is happening during the pregnancy. So first thing mainly which is related to nutrition is gastrointestinal changes. So because of the alteration in the GI function, there will be reduced gastric tone, mobility, secretions and also, which will cause nausea, vomiting, constipation in the pregnant women. So later in trimesters you can see that increased absorption of the nutrients. So because of the needs for the fetus and mother, there will be increased absorption of the nutrients will be there, and there will be relaxed lower sphincter, esophageal sphincter will be there. So because of the regurgitation, heartburns, these all things will be happening. So next, like body fluid changes is happening. So mainly the blood volume is increasing by 50%. So mainly this is for the carrying the nutrients, metabolic waste, and there will be decrease in the plasma proteins, HB level, other blood constituents, there will be the reduction in that. So here we can see that underweight, like the BMI which is less than 18.5. So those people can weight gain up to 12.5 to 18 kg, and healthy weight is like those who are having BMI 18.5 to 24.9, you can go for an increase of 11.5 to 16 kg during the pregnancy time. Overweight people, they are like BMI more than 25 to 29.9, such people can go for 7 to 11.5 kg in their pregnancy time, and obese people, they are BMI which is more than 30 kg per meter square. So they can go for minimum of 6.8 kg during their pregnancy time. So next we are going to speak about placenta. So we all know that it is a reproductive equipment. So the fetus is attached to the placenta by the umbilical cord. So through this umbilical cord, through this placenta only, all the nutrients, all the transfer of the nutrients and other substances is taking place between the mother and the fetus. So what is the role of placenta? So first is, it is the main site like production of several hormones, and it will regulate the fetal growth also, and other maternal support tissues development also. Placenta is having major role, and exchange of nutrients also, as well as all the like oxygen, waste products, these all exchange is taking place because of the placenta only. So once, if at all mother is well nourished also, the placenta is having any problem which will leads to the poor fetal growth. So now we'll see for relationship between like maternal and fetal nutrition. So once if mother is taking inadequate food intake, or like it is like not nutritious food the mother is taking, there will be maternal malnutrition. So which will leads to decreased blood volume, expansion will be there, and inadequate increase in the cardiac output, which leads to decreased blood supply to the fetus. So because of that, the placental size will be reduced, and the transfer of the nutrients to the placenta or through the placenta to fetus will be reduced. So which will cause us fetal growth retardation. So what are like energy requirement during the pregnancy? So first thing, like why we need energy is, first thing is the growth of the fetus is happening during the pregnancy. So development of placenta and the maternal tissues will be there. So to meet the other needs like basic metabolic rate and all will be increased. So to meet that needs, and to deposit the fat, so which will be used during the lactation. So for these all things we have to give additional 300 calorie for during the second and third trimester of the pregnancy. So totally we are spending, whole pregnancy we are spending 80,000 calorie. In that 36,000 calorie is deposited as fat. So later we are using this deposited fat during our lactation time. So inadequate supply of calorie, what happens means the fat stores will be depleted during the pregnancy, so that there will be production of ketone bodies. So usually it is seen during the first trimester because they are not taking inadequate nutrition during the first trimester because of the like vomiting or nausea or whatever the sickness they will not be taking. So coming to the protein requirement. So normally a person needs adult woman needs 50 grams of protein. So extra of 15 grams, that is 65 grams of protein is needed during the pregnancy time. Coming to the fat requirement. So mainly fat is required, mainly it is needed in the fat of omega-3 fatty acid. So 300 milligrams per day is needed omega-3 fatty acid. So because of DHA is nothing but it is docosahexaenonic acid. So which is essential for the brain development as well as visual development. So for this omega-3 fatty acid is important during the pregnancy. So next is calcium requirement. Calcium is 1 gram per day is needed during the pregnancy. So it is for the bone and teeth development, and for the proper muscle contraction we need the calcium requirement, and blood clotting also we need calcium. So daily they have to go for 1 gram per day. Now coming to the iron requirement during the pregnancy. So iron 30 milligrams per day is the normal rate of the adult woman. So during the pregnancy we are supposed to go for 38 milligrams per day. So it is mainly required for the growth of fetus as well as the placenta. So infants when they are born, they will be born with high levels of HB, mainly like usually it is 18 to 25 grams per 100 ml. So building the iron stores in the fetal liver, we need more iron, and which will be stored in the liver, and after the infant born it will be there from 3 months to 6 months. And again like we told that 50% of the maternal blood volume is increased. So to form that also, to form the HB also we need iron, and like entire pregnancy we need around 8-10 milligrams of iron. So even like to compensate the blood loss during the delivery time, we have to add the iron rich foods. So mainly you can use liver, dried beans, dry fruits, green leafy vegetables, eggs, enriched cereals. These all things can be taken. So energy requirement during like folic acid. So folic acid you can go for 400 micrograms per day. So which is required for the blood formation and which will prevent the fetal neural tube defects. And zinc is 12 milligrams per day. So mainly it is synthesis of DNA and RNA. So zinc deficiency, it will may cause congenital malformations. And what all main dietary guidelines we can give is, one is small and frequent meals can be given, and we have to avoid fasting or missing any meals you have to avoid, and fiber rich foods. So constipation is a main thing which is during the pregnancy is happening. So fiber rich foods can be given, 5 to 6 servings of fruits and vegetables can be given, calcium rich foods can be given, iron rich foods. Anemia is a common thing which is seen in the pregnancy. So not only for anemia, we need a fetal iron store. So for that iron rich foods are required. Optimum amount of sodium. So if at all edema or hypertension is seen during the pregnancy, you can restrict the sodium amount. And green leafy vegetables, so which is a rich source of calcium and iron. So you can go for green leafy vegetables. Plenty of water you have to take so that your bowels will be regular. Magnesium rich foods, so which will reduce the cramps during the pregnancy, and fatty rich food, fried foods, excessive seasoning, strong flavored foods. So these all things, if you are restricting, nausea and gastric problems, vomiting, these all will be reduced. And you can give fluid between the meals, not with the meals but between the meals you can give it, and adequate amount of calories, so that what happens, the fat will not get deposited, so which will required for the lactation. Okay. Thank you. Next I will deal with pregnancy, will be continued with the lactation, nutrition in lactation.